Welcome to the medical moment at Marina Hills.
So you start over again.
We're going to do a case study today on Tank the dog. Tank is a German Shepherd-sized mixed breed dog. He's over 10 years old. A couple times he's been in this past year on his physical exam. I got the impression that the front part of his abdomen was broader than I expected it to be, but it didn't alarm us too much, and the owner didn't want to pursue it at the time. About 3 weeks ago, he came in because his back was hurting. And as we were working up his back pain, we took some x-rays and found that he had some calcified stone-looking things in the front part of his abdomen. And we weren't sure if those were actually in his stomach or if they were in the pancreas or the connective tissue in that general region, the front ventral quadrant of the abdomen. And in the process of evaluating those, we treated him, his back felt better, but we wanted to see what happened to the stones. So we had him come back, and that's when we did an abdominal ultrasound. And on the abdominal ultrasound, it turns out that the calcified masses that were there 10 days previous when we took the back x-rays were gone, but we found a mass in his spleen. And being a large breed dog with a mass in his spleen, the concern was that it might be cancer. The most common cancer in the spleen of dogs, older dogs, is called hemangiosarcoma, which is a tumor of blood vessels. And it turns out that those tumors, they grow, they outgrow their normal architecture, they often rupture, and then the pets bleed internally. And so sometimes the way that we discover that pets have hemangiosarcoma is they come in and they're very pale because they've bled into their abdomen. This mass was not huge like some that we see, and so we were preparing to remove it before it could cause trouble. And in the process of preparing for that, we decided that we would evaluate his heart, because hemangiosarcoma sometimes spreads to the heart, and then that's a whole different kind of problem. And before we put him through surgery, we wanted to know if he had a cancer in his heart. Maybe in this senior citizen, we wouldn't put him through the surgery. Well, we did the echocardiogram on his heart and found out that he does not have cancer associated with his heart, which was great news. The surprise was that he had mitral valve disease. Even though he has regurgitation in his heart, he did not have a loud murmur, which they typically do. But in fact, he does have mitral valve disease. Not bad enough to affect the function of his heart, not bad enough to be a barrier to safe anesthesia, but it is something that we'll have to follow up on because it may be progressive over time. So now we knew he had a mass in his spleen. We did not see evidence of cancer in his chest. We knew that he was a good candidate for anesthesia, and the stones that we had seen on the previous x-rays were gone. So with that information in hand, we were ready for his surgery. So 10 days ago, 5 days ago, 10 days ago, we did an abdominal exploratory and found that, in fact, he did have a tumor in his spleen. We removed his spleen and the tumor, of course, that was inside of it, sent it to the laboratory. There's a picture of it. So the spleen is in the middle. That's a pretty normal-looking spleen. This is the tumor in the middle. When we sent that to the laboratory, the results came back hemangioma with a hematoma. Both are benign conditions. So the great news is, for Tank, it was not a malignancy, which means it didn't spread anywhere else, and we were able to remove it before. It had bled inside his spleen, that's what the hematoma was, but it had not ruptured out and bled inside his abdomen. So he never had an abdominal bleed, he never had the collapse, pale, near-death experience of an abdominal bleed. So really, on the whole, it's great news for Tank. Not only did we remove his abdominal mass before it could cause trouble, the stones that were in his first x-ray turned out to be rocks that he ate that he pooped out on his own, so that was good. And we discovered that he has a heart condition that, now that we know it's there, we can manage it and track it over time. So that's a good news outcome for Tank the Pooch.
Question.
Yes, question.
What would happen if you left it?
So it's benign, but it was growing over time.
Yeah.
And the question was, what would happen if we left it? It could have cracked open if he slipped and fell, hit his abdomen on something, jumping in and out of the car, something like that. And that could have made it bleed. And so he could have bled internally from that. So even though it's benign, it's good to get it out.